Disclaimer: this is an educational video. Please consult your physician and physiotherapist for apt understanding of your symptoms. Sports injuries in children. Are they same like adults? Do children need less care? Are we neglecting parenting responsibilities? In sports, the injuries observed in children are often different to those seen in adults for a number of reasons, including weak attachment site, causing avulsion fractures. Growth plate cartilage in children is less able to resist stress when compared to articular cartilage in adults. It is also less resistant to shear and tension forces than the surrounding bone. This can lead to a failure of the physis. The growth plate, or physis, is the translucent, cartilaginous disc separating the epiphysis from the metaphyses and is responsible for longitudinal growth of long bones when increased stress is applied. Thus, in incidents where adults experience a complete tear of a ligament or joint dislocation, children might experience a growth plate separation. Children appear to be more prone to growth plate injuries during periods of rapid growth. A mismatch between bone growth and muscle growth, which leads to incoordinated movements, and thus fracture. Weaker physis, which can lead to fracture. Types of injuries. Apophysitis, caused by traction injuries to the cartilage and bony attachment of tendons in children and adolescents. Often related to overuse in children who are growing and have tight, inflexible muscle tendon units. Occurs in upper and lower extremities, but more common in the lower limb. Osteochondrosis. They occur when there are degenerative changes in the epiphyseal ossification centers of growing bones. Caused by a temporary disruption of blood supply at the bone-cartilage complex, rather than traction. The etiology of this disruption is not known. Multiple possible etiologies have been explored, including genetic causes, hormonal imbalances, mechanical factors, repetitive trauma, and vascular abnormalities. They tend to resolve spontaneously, but should be monitored. Metaphyseal fractures. Fractures that affect the metaphyses of tubular bones. Occur most often in the forearm and lower leg. Avulsion fractures. Occur when there is a failure of the bone. A bone fragment is pulled away from its main body by soft tissue that is attached to it. During periods of rapid growth in children, bone lengthens before the muscles and tendons have time to stretch and develop the necessary strength and coordination to control this new longer bone. This can lead to awkwardness in a child's movement patterns. Traumatic injuries lead to fractures of the bone or growth plate, such as greenstick fracture, i.e. a partial thickness fracture. The cortex and periosteum are disrupted on one side of the bone only. They are unaffected on the other side. They're most common in children aged under 10 years, although they can occur at any age. Premature growth plate fracture equals stress fracture. Strong incoordinated contractions of the muscles lead to avulsion fractures, rather than a tear of the muscle or tendon. When a child presents with a traumatic injury, fracture should be considered. When pain has been present for a longer period or appears related to overuse, growth plate injuries should be considered rather than tendinopathy, ligament sprain, tendon or muscle tear. Contact Sport Physio, Joshua Bruce. For more info and support, please like, subscribe and share for more informative videos.